People will respect you only if you are good. If you are not good, people will not respect you. Anyone in any industry has to continuously keep updating.
This is day one and they built it. And I want to ask you, how you build this brand? How your family built this?
When a patient came, we treated the patient. We didn't look out for the money.
Sir, you were telling anything for the patient is good. Just give some example.
But I think once you get a failure, you must try to get a success very fast. So in this sort of a situation, whenever someone got hurt, regardless of who he is or who she is, we start the treatment.
Hi, I am Santosh Kumar, founder of Health Care Maverick. In our Health Care Maverick YouTube channel, we used to see lot of success stories of hospital and we learn from them. And one of the success stories today we're going to see Ganga Hospital. Ganga Hospital is founded by Dr. Shanmuganathan. And today we have our chief guest, Dr. Rajasekaran, who is a grandson of Dr. Shanmuganathan. Welcome to the show, sir.
Thank you, sir.
And before going into the show, I would like to share more things about Ganga Hospital. Ganga Hospital started in 1978 and it is the largest orthopedic hospital and plastic surgery hospital in entire Tamil Nadu and Coimbatore. They are having 38 operation theatre, which is very huge numbers, and they are doing 13,000 surgeries every year, and they are 650 beds hospital. And in Tamil Nadu, particularly in Coimbatore, Kongu region, if you see anyone got accident, they will say you go to Ganga Hospital. How they built this such a name? They built this such a name because they say whatever good for the patient, you do it. That is the Taraha mantra for Ganga Hospital. If anyone want to build a hospital and get a good name, you should take the success story of Ganga Hospital and let's go into the show. Sir, my first question for you is that how Ganga Hospital started, where it started and how it is grows. Tell us the journey of Ganga Hospital, sir.
My grandfather was anesthetist, sir. So basically he always wanted to be a surgeon, but due to family circumstances he couldn't do his masters and he could finally become an anesthetist. So he always wanted to have a hospital. So when he wanted to start a hospital, he felt that he was one among the very few anesthetists in the whole of the city. In fact, he was the first anesthetist in the whole of Coimbatore. So he felt that he would build a hospital, surgeons could come to the hospital, he would give anesthesia, he would look after the patient both preoperatively as well as postoperatively, and then would give a good care to the patient. So this was how he started the hospital. So they started with a meager 5-bedded hospital. So that's how Ganga Hospital started. It started near Crosscut Road, just near the flyover. So that's how they started the hospital. A very interesting event about the Ganga Hospital was that for the first 25 days after Ganga Hospital was started, there was no patient. I think the most important thing is that today we are having a lot of patients. Today we are managing a lot of patients. But for 25 days when my grandfather did not have a single patient, he managed, and that is what brought Ganga Hospital today. For a long time he was working in the corporation hospital. He just had only 2 more years to do and then he would get pension. He said that he would forgo his pension and then he left the hospital, left his job in the corporation hospital and started full-time at Ganga Hospital. It was started by both my grandfather and very, very ably supported by my grandmother. They worked really hard and they tried going from one part to the other part, and that time they really didn't have any money also. Okay. So without much of seed money, with all the money that they got from the family, they borrowed from the family, they somehow started it, took step by step. And my father always used to tell that even when they did not have anything, even when they had very meager resources, my grandfather was very particular that they would always be very ethical and he would never do anything wrong which he thought in his mind was wrong. So that was the basis behind which we started.
What is your grandmother's name, sir?
My grandmother's name is Mrs. Kanagavalli Shanmuganathan. My grandmother is one of the most is the charioteer of our family. So she was the one when my grandfather told she wanted to build a hospital. She was the main person who really took all the efforts and saw to that the hospital was built. Even till today, she looks after the management of the hospital.
Wow.
So she is a very big, very dynamic lady, and she is the one who gave wings to the dreams that my grandfather had. So it is they who built the hospital. My grandmother was very particular that education was the most important thing. She was very particular about education, and she was very particular about discipline. I think these were the cornerstones of our family, and they saw to that both my father and my uncle read very well. They were the best in their fields, and they saw to that and they worked very hard. I think they gave the basis or the foundation of our hospital and how we were. I think it is this basic culture on which we built our hospital and still remains today. So my father and my uncle both did very well. They were the best outgoing students of in the colleges that they were. They won innumerable prizes, and they went abroad at a time when people felt they didn't need any form of.
What is your father name and your uncle name, sir?
My father's name is Dr. Rajasekaran. My uncle's name is Dr. Rajasekaran. So both went into specialization at a time when people felt that specialization was not needed. So my father felt that he needed to do something very new, and hence he wanted to do microsurgery. So my father is a plastic surgeon. So microsurgery means dealing with tissues, suturing blood vessels or nerves which are 1 millimeter to 3 millimeters, very small vessels. It is the way it is only when you suture these type of vessels can you do lot of things. For example, if a hand gets cut, if a finger gets cut, reattachment would need microsurgery. For example, if a major accident, when there are a lot of soft tissues are absent, suppose we need to give some soft tissue to a particular part, we need to take a soft tissue from another part of the body to another part, it needs microsurgery. So there are several aspects of applications of microsurgery. He was one among the very few who learnt it at that time. He wanted to really increase his knowledge, and so he went both to UK and then he went to US. He gained his knowledge and then he came back. So similarly, my uncle trained in spine surgery and joint replacement surgery, and then they both came back to Coimbatore. So when my father and uncle came back to Coimbatore, they started in 1991 as a specialty center. So they started at a 35-bedded hospital in Ramnagar. The place was also near Crosscut Road, but this was a different place in the Swarnambika layout in Ramnagar. So they started initially, and when they started initially, I think they both really worked hard, and they worked really hard, and then as time grew on, they did very well. So there are a lot of things that really gave good name to the public.
Sir, you said you started your hospital from 5 beds to 35 beds. From 35 beds to where?
So we started at 35 beds, and then later on it just became into 50 beds. And we were very lucky to have another plot coming up for sale just adjacent to the hospital. So that they bought it and they added 100 beds to it. So 50 became 150 bed hospital, and after that it was there till 2007, and then until 2007 it was extremely busy, and people used to stay in corridors and in small rooms, any place one could get, there were patients. I think it was in such a state that we really felt that we really needed to move out to a much bigger place, and we are now we went on to the big place in the Metupalayam Road. So in the A block, which is around 350 bedded hospital. So around 350 bed we started, And later on, as time grew, in the same premises, we added a few more beds to become a 450 hospital bedded. And then in around 2019, we started the B block. So we added another 100 more beds, and presently we are a 600 bedded hospital, exclusively for plastic surgery and orthopedics. These are our main specialties. And now, because of plastic surgery and orthopedics, now we are also getting into cancer.
So thank you for answering that. And today Ganga Hospital is a bigger brand. Even I travel across the country. If I travel across the country, everywhere, if I say Ganga Hospital, they know the Ganga Hospital. They know the works of Ganga Hospital. And in my initial talk, I have discussed that if anyone got accident, you go to Ganga Hospital. This is a very big brand. For orthopedic hospital, this is they want and they built it. And I want to ask you, how you build this brand? How your family built this? Do share a light on this.
Said earlier, sir, when a patient came, we treated the patient. We didn't look out for the money. We most of the times today, if someone has to give debt, if someone has to give you money, even banks ask for some collateral. Banks ask for see what you are got. And even people from the own family may not give. Brothers may not give to their own sisters. Sisters may not give to this thing. And even nowadays, parents don't give to children and vice versa. So in this sort of situation, whenever someone got hurt, regardless of who he is or who she is, we start the treatment. We start the treatment. We tell them that this treatment would cost so much. We tell them beforehand, and when they tell okay, we take that as a granted, and then we still treat the patient.
Thank you for sharing that, sir. I want to ask one question. I want to start from your beginning. And your father, Dr. Rajasekaran, is a big doctor. Everyone knows. And how is your childhood being with them? Because if you go to hospital, they expect a lot from you. How you handle this?
We live in a joint family, and our family is a very strict of a family. I think they really put a lot of emphasis on discipline, and they put a lot of emphasis on education. So, however much the family was earning or not, they always felt that our education was the most important thing in the house. So they gave so much of importance to education, and that is the reason why today I am a doctor, and today I actually done all my education to fully through merit. I did my MBBS at Madurai Medical College, MS at Madras Medical College, and even to get a DNB plastic surgery, I had to write an entrance exam where I was ranked number 11 in the whole of India. And I took plastic surgery after getting ranked 11 in the whole of India, and I was the first person to take plastic surgery in the whole of India. So our family was always to put a lot of emphasis on education and discipline, and I think that's how we all grew up.
So Rajesh sir, tell us that are you willingly take the MBBS? Are you pushed for MBBS?
Since we built a hospital, and then I think almost everyone wanted me to actually become a plastic surgeon. They were also driving me towards that. And at that time, we didn't have too much of thoughts. We did what our parents told us. So we did what our parents told us. And luckily, I also liked medicine. I think I also liked medicine. I also liked surgery, and I also liked plastic surgery. Because you cannot do anything that you don't like.
So tell us what one lesson you learned from your father.
I think the one single question, I think my father is dreadfully hardworking. And the one thing that he really drives him is he really wants the patient to do well. That's it. Anything for the patient is what he wants. I think that's what we all have learned. I think anything for the patient is always good.
Sir, you were telling anything for the patient is good. Just give some example.
For example, the patient comes. He comes in the night. It is the best thing that the patient he needs to be operated in the night. So we have to go operate in the night. So the patient needs the surgery to be done at a particular time, particular date, and I think that is done. For the patient, this is the best. So that the best means regardless of the cost, we try to do that. For the patient, this surgery requires this person to come and do the surgery. So regardless of whether the patient is in general ward or in a high costly room, the patient gets the same treatment.
So, you are a third generation or fourth generation doctor, and tell us one challenges you are facing and how you overcome it.
I'm the fourth generation doctor, sir. Everyone looked to you as to whether you're working at all, sir. If you work, people accept you as a leader. If you don't work, regardless of whether you're born to the chairman or the management family, people don't respect you. I think this is very important, and that is the reason why I feel that people who are in high offices, children of people of high offices, have to work doubly harder than those who are not. I even tell my son, tomorrow you are also going to be a son of a big doctor. People will respect you only if you are good. If you are not good, people will not respect you, and things will become harder. So a person who was born in an ordinary family can read any way he wants, but a person like you has to read properly. Only if you read properly, only if you work properly, can you lead a hospital, or can you lead an institution, or lead anyone. Regardless of where you are born, you need to be really good. I think that's what I feel.
Sir, tell us more about this breast surgery and why you choose this department to grow.
So I think breast surgery is something that we want to revolutionize. Now, breast cancer is the most common cancer in the whole of the world. And in the part of the treatment of breast cancer, in the surgery, the breast is removed. Nowadays, the breast cancer occurs mostly in young women in the 30s and 40s. Previously it was in the 50s and 60s, but nowadays it is in the 30s and 40s. To remove a breast for a young woman in the 30s and 40s is actually dreadful. It gives behind a lot of psychosocial issues to them. So nowadays, with a lot of drugs, medicines and treatment, they beat the cancer. They live. But then after 1 year, they all become very depressed because they can't wear clothes of their choice. Each time they see themselves in the mirror, they get reminded of the disease. They can't even face the spouses. Even to buy a bra, it is actually difficult. So it is actually very difficult for the women, and the women actually suffer in silence. So what now we are doing is that we are not looking only into the mortality aspects. We are now going to give them a life to the women. We want to make them, before cancer, what all the women was, how old she was. I mean, after cancer, they should remain the same way. So now what we are doing is we are doing the breast reconstruction. This is a standard of care throughout the world. But unfortunately, in India, it is not caught up. So what we do is that suppose our breast has to be removed, we remove the tissues from the abdomen along with the blood supply, and then attach it to tissues over here and give a new breast. And in the same way, the patient also gets a tummy tuck. So we make tissues. We are now advancing the breast cancer care. And similarly, if a part of the breast has to be removed, we again replace that part of the tissues so that the breast looks very similar to how it was before. So the lot of times, even for oral cancer where tissues have to be removed, we reconstruct the tissues. So there are a lot of applications of plastic surgery into cancer, and that's what we are doing. And now we are in 1 or 2 years time, we are starting a big cancer center in the Metupalayam road itself.
How many beds?
We are planning somewhere around 300 beds.
So what are the difficult is there to build a new department hospital like yours? Like you are already excellent in plastic surgery as well as ortho. So tell us about it, how you built it.
It was it was and still remains a very, very major challenge to us. We feel that although we've got a very good product, although we have got a very good service that we can offer. A lot of people still tell அது ஒரு எலும்பு hospital. That means it's a bone and joint hospital. So which means that they say it's a trauma hospital. So basically, and then they say cancer they don't do. So so I think this field was actually shadowing the other fields a lot, and was making it very difficult to. But there's one good thing that we had. I think we had we have and still have the goodwill of the people. We have the goodwill of the people, and that's why we are known throughout the country. So now we are cashing on the goodwill of the people, and we are doing continuing our good service in whatever fields that we are, and then we are hoping that we get a much bigger center.
So being administrator in the family, what are the decisions you made? What are the difficult decisions you made over the years, sir?
I think that if you feel that that is best for the patient, I think our family has always told that if you feel that is the best for the patient, just do it, regardless of what people think.
Dr. Raja sir, tell us, the Ganga Hospital is known for groundbreaking technologies, and how this technology shaped Ganga Hospital what it is today.
So now the various certain technologies in which it's on. So suppose we have to replace the skin. So that means we have to do it in such a way that we take only less amount of skin. So we use in terms like infiltration, dermatomes, and meshing and techniques in which we very economically use the skin, and we are able to cover a lot more areas. So now we have a skin bank with us. We have the largest skin bank, just like the eye bank. The skin is harvested from people who die immediately within 6 hours after death. So we take the skin and we process the skin, and we use the skin to cover up a lot of the areas. Similarly, we're using a lot of skin substitutes and so on. So a lot of these, so we are using a lot of technologies in which we are able to make patients live.
Sir, the healthcare industry is continuously evolving. How your hospitals are keep on updating on this?
Anyone in any industry has to continuously keep updating. So we regularly go to conferences where we present our work, and when we present our work, we also keep seeing as to what are the latest advances, what will shape it, what are really good, and we learn it and then we implement it.
Sir, in Ganga Hospital, if you see, every day lot of hospital coming with a lot of pain, and they coming with a death or life situation are very difficult. Every day it's difficult for you to see the patient who with the pain, and sometimes the patient will die also. How you handle this emotion while going home? Tell us about it.
I think a lot of things are very emotional as well. For example, especially in trauma. But then over a period of time you get used to it, and then you have to remain emotionally detached and just do what is required for the patient. Because if you each time you get emotionally too attached, then you cannot do it well. I think this happens more in cases where you do very well, and after sometimes some complication happens, some infection happens when you don't expect it to happen, and then they suddenly die. I think this happens a lot in burns as well. So you get really attached to the patient because they've been there for a long time, and suddenly they die, you feel shattered. Even though we are trained, and even though with a lot of experience, we do get shattered. But what we always feel is that once you have a failure, it is extremely important that you get a success very fast. So that means a lot of times people think that once you have a failure that you should not do it again. But I think once you get a failure, you must try to get a success very fast, so that you erase the memory of the failure and go for the success.
Sir, what is the one fulfilling fact that make you happy while doing this as a practicing or running this hospital?
The fulfilling fact is that whenever patients do well, whenever patients come to us and say that, sir, you really did us, or you really made our family much better, I think we are very happy. I think it is for these moments that we work really hard. And I think we work to make the people do well, and when they do well and when they achieve and they come back to us, I think that's when we really felt very happy.
So, Raja sir, the Healthcare Maverick YouTube channel is all about how you should run a hospital. That is why we have this podcast. So, in this aspect, I want to ask a question to you. See, you saying a lot about people, and we should think about what is good for the people. At the same time, what is good for the hospital also we should see. And you have to pay salary, you have to pay every other miscellaneous expenses, legal aspect, finance. So how Ganga Hospital handling this? How Ganga Hospital having this wonderful system to become a successful hospital?
Definitely, the bottom line should be respected. If the bottom line is not respected, you cannot do good work. I mean, regardless of who it is, even the Tatas, they have to produce a lot of profit. Only when they produce a lot of profit can they help people.
Yes.
So the business has to be run with a lot of efficiency, and only when they do it with efficiency will the business do well. When the business is done with a lot of efficiency, then automatically it does well, and then finally only then can you help people. Without having enough money in your pocket, you cannot help people, and for helping people at least you need to do well.
Sir, I see in Ganga Hospital lot of people are working, and I think more than 1,000 people might be worked. And what would be the strength of the hospital? Just tell us.
So now we are going around 3,000 people. Actually, a lot of politicians, they say that a large company has come, say Toyota or big companies have come in, and then they feel that they have put a lot of employment. But actually, hospitals produce more and give more employment. So 3,000 people, around 3,000 is for direct employment. It's a direct employment. Indirect employment is given to so many more people. For example, I think OP card someone has printed. So the printing business is doing well. So a lot of people who have to come for the food has to be given to hospital. So a lot of food industry is also doing very well. So there are a lot of indirect people who really benefit, and of course our patients.
Sir, how many doctors are working in your hospital and how you manage them?
250 doctors, sir. I think it is extremely challenging. I think as people are also changing, I think doctors are also changing because doctors come from the people, isn't it? So I think as people also change, the doctors also keep changing, and it's very important that we keep telling them that patient interest is our most important interest. And most of the senior doctors are people who have grown through the ranks. There would been a very junior doctor, and then they would become a slightly senior. And everyone grow through the ranks, including me. We all grown through the ranks from being the most doctor to a senior doctor.
So tell us about that. How you joined as a junior doctor and what you are today?
So soon after I finished my surgery, I joined a hospital, and then I was working as a junior most doctor in the department. Junior most doctor.
So everyone know you are the son of Dr. Rajasekaran.
Everyone knows me. They know me from birth. so they started as a junior most doctor, and then I joined as a postgraduate, and then from 2011 to 2012 to 15 I joined as a postgraduate, and after finishing I worked as a senior registrar, and after working as a senior registrar, then I went abroad for surgery training. Then I was as a junior consultant, then I became more senior consultant. So we go through the ranks. So it's not like you come one day just because you are so and so's son, you are given a post immediately. It never happens. So it is given only. You have to work through it.
Raja sir, I was thinking that first generation building a business is difficult. Yes, it is difficult. But being a second generation also, it is so much difficult. Now you are fourth generation. Everyone look at you at a big level. You have to achieve something. So being a fourth generation of doctor, what are the pressure on you and how you overcome it? And also share that what you want to say if someone is coming and taking over as a second generation in their hospital or any other business.
I think first and foremost, I think the basic principles are all the same. I think you need to work hard. You have to have a passion for the field. You need to have a lot of discipline. And I think the principles to come up are all the same. Whether it's a person whose father is a doctor or a non-doctor, it is all the same. The only thing addition is that there's no difference actually speaking. People think there's a difference, but actually there's no difference. The only thing that you really need to do is that you're going to have a lot of pressures. I think you really need to just concentrate on the way forward and not think about the pressures. If you're going any time at any given point of time, you say that you think that your father has done this, so I have to do this, then you're going to quote disaster.
So fine, what is your long-term vision for your hospitals?
Our long-term vision for the hospital is to be the best in what we are, sir. I think we have to be the most respected hospital. I think that's what I wanted to. I think we must. I think see today we have Tatas, we have Ambanis, we have Adanis. Adanis and Ambanis are much richer. But if Air India was supposed to be taken by Ambani or Adani, there would be a lot of uproar. When Air India was taken up by Tata, everyone received it and loved it. I think that's a trust that they built among the people. I think that's what we want to be. We want to be the Tatas of the health industry. We want to be respected.
So wish you all the best, sir. Definitely it will happen, and that too from Tamil Nadu and Coimbatore. I'm very happy for that. And if you want to remember for your contribution, what it would be?
I think the contribution now that I'm really doing is that we want to revolutionize burn care, and we want to revolutionize breast cancer care. And I think we are doing it in small ways, but I hope it becomes bigger and then it becomes really big.
Wonderful, sir. Thank you for coming and being with us for this Healthcare Maverick podcast.
Thank you, sir.
Definitely, you have thrown a lot of light on this podcast. Definitely, whoever watching this video, definitely helpful. And we will wish you all the best for the future of Ganga Hospital. And whatever you say, it will become Tatas and Ambanis of healthcare industry. And I want to see that in my life. And also, I'm personally thankful for Ganga Hospital during the COVID. They treated my father and mother and brother, and I'm from the bottom of the heart, I'm thankful to Ganga Hospital. Thank you for watching this video. Your likes, your shares, your subscription only keep motivating us. If you like this video, do share this video to your friends and families, or doctors or medicos, whoever think that they want to build their hospital. And thank you once again. I'll meet with you another new episode. Thank you.